Hi, everyone, and welcome to Medically Speaking, a UCLA Health podcast. I'm your host, Dr. Eve Glazier. Our listeners may not know this about me, but in addition to hosting this fabulous podcast, I'm also a primary care physician, and I really love what I do. Primary care is often described as the front door to the healthcare system, but it is so much more than that. It's about building long-term relationships, preventing illness before it starts, and helping people navigate every chapter of their health journey. So in today's episode, The Power of Primary Care, we're going to unpack what primary care really means, why it matters, how to choose the right provider, and what you should expect when you go in for a visit. And of course, we're going to get into some classic listener questions like, is it okay to Google my symptoms? And do you actually believe me when I tell you I only drink one glass of wine a week? Joining me today are two incredible guests, my wonderful colleagues, Dr. Will Carroll, Dr. Maria Hahn. A little bit about these wonderful people. Dr. Will Carroll is an internist at UCLA Health. You practice both traditional primary care and also complex medical care at our UCLA Extensivist program, which specializes in individuals who have frequent hospitalizations, really complex issues. You're also our clinical medical director of our UCLA Alzheimer's and Dementia Care program, and also our medical director for senior care. You're a passionate advocate for health policy, and you actively engage with our American College of Physicians and the California Medical Association, and you're just a phenomenal person. Dr. Maria Hahn, who I've also known for a really long time, one of my favorites. You're an internist as well, Chief Medical Officer for Ambulatory Care at UCLA Health. You practice primary care in a lot of different settings, but currently at Iris Kenter, right? Women's Health Center. You've got an MBA from UCLA Anderson School. And you're especially interested in how you can innovate in our clinics to improve the way we deliver high-quality primary care. So, Will and Maria, thank you so much for being here. Let's get into it. And why don't we just start with the basics? Will, I'm going to ask you first, what is primary care?
Of course. Yeah. I think, it depends on the day and it depends on the person. It really can be anything, that can be, I have COVID, that can be, I need my medications refilled. I think when I think about primary care, it's really the person's doctor, your doctor that knows you the best, has probably seen you the most in your life, has kind of grown up with you, right? Like knows when someone's had a child, knows when someone's kid has gone to school, someone that, you've been seeing over a long time. And, I think when you think about the purpose of primary care, the purpose was that everyone has a doctor and someone that they can go to in times where nothing's wrong, right? Like a nice boring visit, coming in for your physical, coming in to get some paperwork done, but also the person that you reach out to when something is going wrong, right? Like you have a new diagnosis and you're trying to learn how to navigate that. You caught a cold at a party last weekend and you need some medications just to get through that. I think that's how I imagine how primary care has evolved over time.
That's great. I mean, I think what I'm hearing too is that it's comprehensive. It's everything. It's the person in your corner, your coach, your navigator. I guess to the comprehensive idea, anything else you'd add, Maria?
Yeah, I kind of think about having a primary care doctor as having a very medically savvy best friend. And it's someone who knows you really well, ideally over a longitudinal period of time. They know your history, they know your family, they know your habits, your hobbies, all of these things. And they kind of take everything that they know about you, that they've learned about you over the years, and they help you make good medical decisions for you and figure out how you can, as an individual, stay healthy and stay well and thrive.
Wait, I love the best friend because I feel like that's what I do every day, is be a best friend for my best friends and my patients. I mean, doesn't everyone want that? One of the things that I realize is confusing for people, even as we're talking, even just starting out, is you guys are both general internists, as I mentioned in the introductions, but who practices primary care? Like lots of times people ask me and they say, what's your specialty? And I say, I'm a primary care doc. And they say, wait, what does that mean? And I often say, I'm a pediatrician for grown-ups, right? Or a GP. Right. And Will, the way you're talking about it, like that old school, like, right? Almost that doctor who's going to make a house call or like come to your house or, but I mean, let's for our listeners actually kind of describe like who can practice primary care, like this comprehensive, holistic, managing everything from, right? Like screenings, giving your vaccines, managing your colds. Who practices primary care?
It is a large pool of people. I mean, in the world of pediatrics, primary care is practiced by your pediatrician.
Right.
I think that's the first doctor the majority of us met in our life, right? Our parents were taking us to the pediatrician. And for pediatrics, it's really confusing because then you graduate out of pediatrics. And so they only take care of children. And so as you go and transfer over to adulthood, during the time of college, you start seeing an internist, so an internal medicine doctor. But then we also have other folks that help us with this as well. And that's their mainstay. We've got practice of family medicine, and family medicine doctors have been trained on some pediatrics. They actually do some OB. They do some adult medicine. And so through their training, they're able to take care of patients throughout their entire life, including in pregnancy as well for our female patients. And then in the space of OB, I think obstetricians and gynecologists deliver a lot of primary care in the space of women's health. When you're talking about breast cancer screening, when you're talking about HPV screening, you're talking about cervical cancer screening, a lot of that care is actually delivered in the office of obstetrics and gynecology. Now, in this day and age, too, there's such a shortage of primary care doctors that a lot of America is receiving primary care services through allied health professionals. So whether or not that's a physician assistant or a nurse practitioner, many of them themselves, their training is different than ours. They actually may have done some additional training in primary care before they went out and started practice, or they may have just started practice, in collaboration with a physician. So I think the face of how primary care is being delivered has definitely changed over time as well.
Yeah, I mean, we're definitely like the front line of the medical field. And the OBGYN, I think that doesn't occur to a lot of people right away.
Right.
But, we had Dr. Maya Zapata here, and there's a lot of care, right? It's like whoever you're going to see the most, who you're going to formulate that relationship with.
Yeah, I think that's right. I think it's a lot of different people and specialties are trained in primary care, and the population, the age of the patients that they take care of might be a little bit different, but it really is your routine doctor. It's the doctor that you're seeing on a regular basis, whether that's yearly for your annual checkups, or for some individuals that'll be more than yearly. But it's really that person that you're seeing, whether you're sick or you're well, and they're helping you navigate your health in the healthcare system.
Which reminds me, too, because, Will, you're saying there's like different places to get this primary care. One of the things that we really advocate for in terms of primary care is establishing, care with someone, whether you're sick, whether you're well, but in a place where you can have this comprehensive longitudinal relationship, right? So, if you need an opinion to get you through, a surgery, if you want, support. But a lot of people, I think, often will get their care from like urgent care, right? Or what we call immediate care. And maybe we could just kind of define those a little bit for our listeners. We know what the emergency room is, but mostly I want to advocate for people establishing these relationships. So can you talk a little bit about, getting care, like what's an immediate care for or an urgent care?
Yeah, definitely. And there's really, the practice of urgent care and immediate care has exploded because I think, when you think about kind of the state of primary care in America, we just frankly don't have enough doctors. We have a shortage, and our population has grown, and thankfully we've actually had improved access to primary care services as well through multiple governmental, interventions over time. But because of that, it got harder to see your doctor. It got harder to see your doctor, and so when you called your doctor for, hey, I caught COVID on the plane, the doctor couldn't see you for a week, right? And so then people started going to these urgent care facilities, which is great because the patient needs to be seen. There is a need that needs to be addressed that day. But I think through that, there's been some patients that have lost the understanding of the importance of connecting with a primary care physician in the first place, because these urgent cares, you're never really seeing the same physician all the time. And really the purpose of it is to solve that one problem that you present there today with, right? Give me a medicine for my COVID or an antibiotic for an infection. But if you only pursue that type of interaction with healthcare, you're missing out on all the preventative services that you would be actually embraced in primary care, but also having a person that really knows. I think, Maria, you said it best earlier where, you get to know everything about this person, and all of us are so different that there's so much, the art of practicing medicine, right? How do we interpret everything we've learned for everything I know about you, Eve?
Yeah.
Right? Like, what medicine am I going to recommend that you take for X, Y, and Z condition? Or you need to undergo a surgery, and understanding, is this really the best thing you would want to do? It reminds me of a conversation I had earlier this week where a patient was recommended for a surgery, and I know that this individual's, one of their most important things to them is that they really love to play paddle tennis. They love to play paddle tennis. It's their big passion. And this patient was particularly nervous about pursuing the surgery. But I knew if the surgery was successful, the patient recovered well, they'd be able to play their paddle tennis. And right. So having the ability to understand the importance of that and actually having that conversation with that individual really helped quell the anxieties around the procedure, but also informed the decision for that patient to say, oh, actually, you know what? I think this sounds like a good idea, actually.
It's so excellent. I mean, it really is true. I mean, I think we're always wary of like episodic care, which has its place. Right. And by episodic, right, I mean, right, I wake up with a sore throat. I don't have a primary care doc. I'm just going to go into urgent care, get my cough evaluated. And that works a lot of the time. But when someone comes in and you're evaluating and maybe solving, right, their problem in context, it's often easier. It gives so much dimension. I mean, something that happens a lot in my practice is I'll have a patient who, again, luckily I've had the amazing fortune of knowing them for a long time, and they'll come in and they're like, tell me what's going on. They're like, I have a horrible headache. And sometimes I'll be like, well, tell me what you're worried about. And, this particular patient said, I'm really worried I have a brain tumor. And then I'm like, tell me why. And then it turns out because, they had a family member who was recently diagnosed. And I said, okay, let's step back. First of all, I know you don't have a brain tumor, and now let's get to talking about the headache, right? And I know you, and I know what matters to you and what you're worried about. And it so helps then the care almost treatment plan. I don't know if you have similar experiences.
No, I think it really allows you to individualize the treatment plan and to personalize how you're taking care of that patient, that person. Right. I think the flip side of that, though, for all the listeners is also don't be afraid of the team.
Yes.
Healthcare has really become, and it's had to become a team sport. And so there is not only your primary care physician, but also your specialist. Mm-hmm. You'll have the physicians that you see in immediate care. You'll have the allied professionals like Will's talking about, pharmacists, social workers. All of these people are part of the team. And I think they can all play a really important role in supporting you and supporting your primary care physician in really making sure that you're getting the care that you need.
I mean, it's so true. I mean, this isn't an advertisement per se for UCLA Health, but one of the reasons I really like to be part of an integrated health system, right? And that, people can complain about an electronic health record, but I mean, it's awesome, right? I mean, our patients, basically, we can see all of their care, right? Wherever they are. Right. I can ask, our urology colleague was here earlier. Right. I can reach out to him and get his input, and then I can see his opinion and his recommendation. Right. I mean, it makes a tremendous difference. And then again, right? I mean, we have social workers, we have therapists. And we're all working together, and
all of that information is coming back to the primary care physician,
Exactly.
so that the primary care physician who knows you best can guide you in terms of next steps.
I mean, I think that's ideal.
Yeah, I mean, we've made strides in IT integration where, one, the information is passing to the right people, right? I think as we continue to integrate, all the electronic health records, you can see what's happening. You know exactly in live time with your patients what's happening today. I can think of, one situation where running into someone, you're like, didn't you just get out of a procedure? Because the computer told me that. I knew that happened that day. And I think one of the nice, when I first joined UCLA after residency, I remember, getting up and running in the extensivist clinic where some of these patients, there's such chronic complexity that it required such a big team, like Maria's mentioning, where there was a pharmacist, there were 4, 5, 6, sometimes 10 specialists involved. And I was so impressed when, there was a really complex situation. I'm kind of juggling a few things. I'm not sure of the exact answer. I needed their help. And we could talk to each other, right? Like sending off a message and getting a response same day, a few hours later, giving someone a call, getting an answer back right away, right? I do think the integration of the information technology has really helped us actually make this a team sport.
Yeah, absolutely. And especially if we do it with our patients. I mean, can you talk a little bit about, I mean, I think we all agree on like why primary care matters. I think maybe even for our listeners, like what do we do during a primary care visit? I mean, right. I mean, you mentioned, colds or, again, being their person, their doctor, which I love. But I mean, what else do we do in primary care, in terms of what is when I say comprehensive, like, what do we mean?
Yeah, so I think it's really the foundation of a patient's healthcare journey. And so it starts with the things around prevention, making sure that patients are getting the screening tests that they need, around cancer screenings, that they're getting the immunizations, the vaccinations, all of these prevention, wellness focused pieces. But then it's also the management of chronic conditions. So if you've got high blood pressure or diabetes, your primary care doctor is helping to connect the dots on that to make sure that those things are optimally managed. And then they should really be also your first line contact when you're not feeling well. Yes. Or you just have a question or you have a new concern or something that you're wondering about. That's the first place that you can go to raise a flag and say, I'm concerned about this, I want to talk to somebody. Your primary care doctor can be that person. And from there, they can direct you, where you need to go. If you need more expert help, if you need, more specialization in a certain area, they can direct you.
Do you often feel like you're also sometimes your patient's advocates?
Oh,
yeah,
absolutely.
definitely. The healthcare system is so confusing.
Absolutely.
It really
and
is.
navigating it, even for us, we're on the delivery side of the healthcare system. And sometimes when I'm a patient or my family members are patients, it's so hard to navigate. And so your primary care doctor, I think, can also partner with you in figuring out how to do that part of it.
Yeah, I think that's an incredibly important part for both, care that's not necessarily being delivered and sometimes care that's overly delivered, right? I mean, we talked about certain situations where I think if the patient was talking to someone that wasn't familiar with their background, or say that, for example, that patient that you saw with a headache, and you knew the family history, you knew the concern about that, and you watched them go through that experience, if they had presented to someone that was unaware of that history, and sometimes that complete history is not obtained, right, in a urgent emergency room or immediate care or such, that can sometimes lead to the slew of testing that, one, might not be necessary, but two, also can lead to some damaging outcomes. Unfortunately, it can lead to anxiety, it can lead to unnecessary procedures. It can kind of open Pandora's box where when you have an established relationship with the primary care doctor, we can help direct that individual to additional services, knowing, everything that's happened in the past with that person.
That is such an excellent point. I think for a long time, I think even when I was deciding to go into primary care, maybe before, let's not date myself, when HMOs were, which are management organizations, health management organizations, where by insurance rules, right, you need to get a referral from your primary care doctor. I think, unfortunately, sometimes primary care docs were seen as like gatekeepers, right, and sort of a barrier between a primary care doc and a specialist. But I do like to think that we've evolved, right? And it is more of like, no, let me be your partner, right? Let me see what I can do, right? Before sending you unnecessarily to a specialist. And I mean, I have that brain tumor example. I have so many times people come in and they want a referral to a gastroenterologist, or they self-refer, right? And like, to your point exactly, they have all of these tests. And then I say, listen, I know you, let's actually have a different conversation. And, they're kind of suffering from anxiety.
Right.
Yeah, definitely.
That has manifestations that are gastrointestinal.
Entirely.
Yeah. I think your primary care physician can be your partner in this exercise around when should we worry?
Yes.
Or when do we need additional information?
And I love the we.
Yeah. And there's so much information at the fingertips that patients have, through Google, through ChatGPT now. Everybody's doing that. And they have kernels of information. But I think you can bring that to your primary care physician and engage in the exercise of when should we worry? And do we need to look into this one a little bit more, or can we be reassured?
Well, I mean, speaking of Google, what do you guys think about our patients Googling their symptoms? Why are you laughing? Just kidding.
Dr. Google? Yeah, no, I think it goes to, the world has changed and there's so much information available, and there's pros and cons to that. I think there's great pros, and people are educated on their health if they want to be, right? Like the information is out there. I think the con for that is these online algorithms, even these AI algorithms now, can't contextualize everything about that person. And so, you know, it gets to the point where sometimes it's like I stub my toe on the door and my toe hurts, and you put it in the ChatGPT and it says toe cancer, right? Like cancer is included in all of these algorithms, but it's so low, right, on your list of things you worry. That person using that information technology does not know that, right? They don't know that. And I think that's still where it takes the physician to help contextualize that information. But I do think it's getting better. Like I really, you know, even just in the last 2 years, like these things have gotten a lot better. And I think it's going to be a good partner for us in the future. You know, does it send out when do I get my colon cancer screening, right? Like when do I get my mammogram? All this information's out there, and they're getting more advanced where you can add in your family history, you know, like what happened to your family members. And there are some changes and nuances to guidelines based on that information. And so I do think it's great. Like we've really expanded the venue of the information. And I do think, you know, we've all seen where that's actually a large part of the primary care now, right? Is contextualizing information that has been read online, whether or not that's vitamin supplementations or, you know, hormone testing or tests. Like, is there a test available? Is there a tumor marker test, right? That's a big topic right now because there's some great information coming out through research, and it's just, you know, we're not ready to use it yet because it's not available to us. But, you know, I think patients are more engaged because in general, people have more information in their hand and their phone than we ever have before.
I mean, the engagement is great, right? And I mean, we could talk forever about, you know, AI, but I mean, let's feed it great information. Let's partner. I mean, I'm sort of like with Google, it's like drinking. I'm like, just don't Google alone.
Right.
You know, let's partner and chat about it. Right. But no, it's true. I mean, I definitely don't want to disparage, you know, our patients who are who are engaging with good information. We just need to, you know.
Right. And a lot of people use that because they don't know. They'll come and say, I don't know if I should like bother you with this, right? So I looked at Google first so that I could figure out whether or not this was something I need to go to the doctor or not. Because there is, let's be honest, there's no handbook that says this requires a doctor's attention. There's really not. And so what that means for everyone is different, right? There are some situations where you say, gosh, I really wish I knew about that last week. You know, I wish this person had called me sooner. And then there's the other side of the spectrum where you're like, no, that's actually okay. Like you're fine and we're okay. But I think, you know, again, going to IT, you know, now your doctor is able to communicate with you electronically. And I do think those electronic portals are great for concerns like that.
I mean, I think that all patients should deserve amazing primary care docs like the two of you. What would our advice be, though? I mean, I love hearing what you're saying about primary care. I hope I'm a good primary care doc. But how do we instruct, I think, our community and prospective patients? Like, how do you choose the right primary care doctor for you?
Yeah, I think there's so many factors that go into that. But I think ultimately you're talking about the power of primary care at the beginning. And I think the power of primary care is that relationship. Yeah. And so you do want to find, I think, a primary care physician who you kind of vibe with. Yeah. Who you, and when I say vibe, what the piece I'll highlight is someone who you can be honest with and be open with. Yes. And who you feel comfortable bringing your concerns and your anxieties to, and who you also can feel reassured by. Right. I think that's a big component of the therapeutic piece of a primary care relationship. But it's also who takes your insurance and who's close to your house. And, you know, if you want your kids to see the same doctor, do they also take care of children? You know, there's those kinds of practical questions too. But I think, you know, over time, you do want somebody who you feel comfortable with.
No, and the trust is so important and being honest. I mean, that was, you know, I was joking in the introduction about, you know, do you really believe me when I tell you I only drink a glass of wine? But I think what it's speaking to is like, you know, can I trust you and not feel judged? Right. Can I just tell you and share who I am? I think also an important point is, you know, give it some time, right? You might not vibe with someone, or you might vibe with them for now, and then you evolve or things change. Like, it's okay to break up with your doctor and choose someone else. Like, these relationships are dynamic. But you're right. There's some very practical considerations as well. But I definitely just want to encourage, all of us, just like find the right person for you.
Yeah, and because it is a longitudinal relationship, you can also bring some of those relational issues.
Yes.
I'm going to say some of those relational issues to your doctor. And so if you did have what felt like a bad interaction, or there was something that was said that it didn't make sense to you, or you didn't feel understood, I think bringing those things to your doctor and having a conversation about it, maybe a short conversation about it, is totally reasonable and appropriate. And I think actually strengthens that relationship over time.
I've had definitely examples where patients have made me be a better person and better doctor.
Yeah.
And if they take the time to say, like, listen, you didn't explain this, or I felt like you blew me off. It's hard to hear, but it's the truth, and it does strengthen our relationship. I'm not talking about weird boundaries, everyone. But I mean, absolutely. Yeah, it is relational.
Yeah, it's totally relational. And I think just feeling comfortable with that person. Because it's your body, and there are parts of your body that you may need to talk about, right? Like, things happen. People get hemorrhoids.
Yeah.
People have sexually transmitted illnesses. These are private parts of our body that not too many people in the world, maybe, depending on your life, have seen and you feel comfortable talking about with. And so I think, just feeling comfortable and not judged, just not feeling judged. Like, you should feel like secure in that relationship. And I agree. I think, probably the things doctors are the worst at is making sure the patient understands what we just said. Because guarantee you, for two reasons. One, we all trained in medicine and this is our day job. So this is our bread and butter. So for that reason alone, we have trouble sometimes translating our knowledge into human language, right? Like, it makes sense in my mind and it makes sense in all of our minds here, but everyone else is like, what are you even talking about?
And then they go and Google what we said.
And then they Google it and they're like, did she think I had cancer?
Right. But then call their friend instead of you back.
Exactly.
And you're like, I'm not sure. So like, I really do think it's so important that before you wrap up that visit, if you have that feeling in your gut of like, I still don't understand what the doctor's saying.
Yes.
Just stop them for a second.
Well, that's our fault.
Yeah,
right?
Stop them for a second, because that doctor probably doesn't know that.
Right.
Probably doesn't know that. And I know we teach our residents all the time, right? Like the teach back.
Yeah.
All the time. Like, all of us working in residence with trainees. Did you teach back? Did you confirm the patient understood?
Okay.
It's probably one of the biggest things that we're always harping on them. And then we go and do it ourselves.
Right.
We go and do it ourselves because the day is busy and that's just, we kind of get lost in it. So, I would say for patients out there, like, just make sure like you got your questions answered and you understand actually what was mentioned, because the doctor will be very happy to explain that, because that was like the purpose of that interaction.
And also, like, as to your earlier point too, you are never bothering us. Like, we really need to get that message out. Like, whether we're on call, whether we're in the office, you are not bothering us.
We want you to understand.
Yes, yeah. It's like, I know it's like our job, but it's also our vocation.
Right.
Totally.
Right.
I want to know why you guys decided to go into primary care. I'm curious. I mean, both of you have amazing leadership positions, like within UCLA Health. But what kind of drew you to primary care in the first place? I'll start with you, Maria.
Yeah, for me, I was actually inspired to go into primary care by my dad. I grew up in a very small town in northern Michigan, a town of like 2,000 people. And for 50 years, he actually just retired last year. For 50 years, he was the town doctor.
Oh my gosh.
And so I grew up watching him take care of this community. And we did house calls, and sometimes on the weekends, my siblings and I would have to tag along. And he was on call every hour of every day, and every single day of his career rounded in the hospital. And for how much work it was, I just saw how much joy and meaning he derived from it. And also the impact that he had on patients and their families over their entire lives and their kids' lives. Yeah. And I just wanted a slice of that and to be able to impact in a similar way.
That's incredible. You are really carrying on an amazing legacy.
And medicine has changed a lot. Obviously, I'm very far ways away from northern Michigan, here in Los Angeles, and very far from the town doctor. But I think there are pieces that are paralleled in the primary care that I practice too.
Oh my gosh, even just the everyday interaction with people, like that doesn't change, I think, no matter where you are, honestly, in the world.
Yeah.
That's incredible.
Yeah.
Congratulations to your dad.
Yeah, no, congratulations. Yeah, it's a long, amazing career.
Well, we feel lucky for you.
Thank you.
What about you, Will?
It's amazing. I think there's like 2,000 people live in this block.
Exactly.
You know, like what a different world. It's amazing. Yeah, no, I think, you know, I was someone who always liked whatever I was doing. So like in med school, I was going to be a surgeon on surgery, and then I was going to be an OB on OB, and then I think I was going to be ER for a bit, and then I fell into internal medicine. And for listeners, like internal medicine is great because you can do things like primary care, but then you can specialize also in all these different specialties, right? Cardiology, oncology, gastroenterology. So it's like you kick the can down the road for a few years, right? You're just like, I don't really need to make that much of a decision right now. So, you know, that's kind of how I ended up in internal medicine. And then through residency training, I was kind of doing the same thing. So, you know, internal medicine, like I said, it has so many different specialties. So I was bouncing around specialties. I was going to be a cardiologist taking care of heart attacks. And then I was going to do oncology, you know, taking care of cancer patients. And I think I also had a phase in hepatology, which is taking care of patients' livers. And then I finally realized, you know, I was getting to game time. Like we had to make a decision. I think, you know, through that process, we were getting towards the ends of residency, and it was either you apply for another, you know, set of training, or you go and get a job in something. And so I kind of took some time to reflect, and, you know, I had great mentorship in my residency program. They were amazing. And they really helped me through that time, you know, just thinking like, what do you like in this? You know, parsing out like what parts of this job do you like, and what are the things you like the most? And I enjoyed a lot of it. And what I started realizing was, you know, thinking at that time I was doing some primary care in our clinics, and I was like, I really love seeing the same patients over time, you know, seeing how things play out, right? Like finding a problem, fixing a problem, but also helping that person through the process of overcoming that problem. That navigation piece, right? And that really stuck with me. Like, I thought that was really great. And I like the idea, too, of being a person's doctor, right? Like, I don't really have, like, my swim lane. I can kind of stick my fingers in everything. And you kind of have to know a little bit about everything. You know, you need to know enough about everything so that you know where to get that person to when they need to be there. But between like the longitudinal relationships, I think it just makes the day so nice. Like it really brings out joy in the practice of medicine. And to be honest, it makes it easier, right? Like having established relationships with people really makes it easier navigating all the difficulties.
Yeah, and practice medicine.
You know, is really great. So I think that's really like how it kind of drew me, you know, into it, honestly. And now a few years out, I mean, I think, gosh, this is 7 years out now. It's a blast, you know? It's like a total blast. You never know what you're going to find that day, right? Like you walk in the door, you kind of think you know what your day is going to look like, and it never ends like that. It's great. But you also don't know what that patient is going to share with you. And I love that part.
Yeah.
Because I'll come in and I'll say, so I think we're going to talk about like high blood pressure and diabetes and curveball. Totally something else. You know, it's totally something else. But I like that.
Yeah.
You know, it's nice. It keeps you on your toes, keeps you fresh, and it just makes it exciting.
It reminds me that it's such a privilege, right, to know these people. And when they share themselves, especially over time, I mean, I almost have like no tolerance for small talk in my everyday life because I'm so used to having these like super intimate, conversations with people all day long. So I don't understand when people don't tell me like all their stuff right away. But it's interesting because you're talking about like choosing a specialty, and you're like, I liked the heart, I liked the liver, whatever, I liked the liver. And then it turns out like you like the person as the organ system best, right?
All of it.
Like all of it.
All of it.
That's just most interesting.
You get to the end of it, you're like, well, actually, I like internal medicine, so why don't I do it all?
Yeah.
Why don't we do it all, and we'll have a blast doing it.
And you do.
Completely.
So I think for, our listeners who, I want to really make sure we're saying, and I think you guys would agree, everyone needs a primary care doctor, right?
Yes.
No matter how old you are, how young you are, everyone needs a primary care doctor. So I'd love to explain to our listeners a little bit what happens when they establish care with a new doctor, they come in for a primary care visit. Just nuts and bolts.
Yeah, definitely. Maria, you want to take a slab of that?
Yeah, I think the first piece is plan ahead, because especially at this moment in healthcare, it can take a long time to get an appointment.
Oh, okay. That's what you mean by planning ahead. Okay.
So kind of plan ahead and make sure that you're scheduling an appointment, before you might need it.
Yeah.
And then there's going to be this whole process of getting to know the doctor and the doctor getting to know you. And that can look like a lot of questionnaires through the patient portal. Sometimes those questionnaires are still happening on paper, but it's tell me about yourself.
Yeah.
What is your medical history? What is your family medical history? What are some of your social habits around smoking, drinking, sexual activity? Those are all things that are health discussions for us.
Because they have clinical implications.
Absolutely.
Right. No judgment. Just implication.
It's definitely not a moral or judgmental conversation. No. It's totally a health-related conversation. But it'll be those kinds of questions. And then going through your medication lists. And then you'll come to your doctor and you'll meet the whole healthcare team. Yeah. You'll meet a medical assistant who will make sure that you're comfortable, take your vital signs, get you into the exam room. You'll meet your doctor. And that will be an opportunity to have a conversation and to talk about some of the things that are top of mind for you. But also to make sure that, like we said earlier, you're up to date on all of your screenings and your vaccines, and that you're thinking about your health-related goals that are relevant for this time in your life. It often includes a physical exam, a head-to-toe physical exam, and then an opportunity at the end again for you to, as Will says, ask questions and to make sure that everything that you talked about resonated, made sense to you, and to figure out what are some next steps.
And all those, when you're talking about screenings, right, or vaccinations, those are all age-related, what we call evidence-based. I don't know if you could kind of go into a little bit of, we're not just whimsically deciding.
What is evidence-based, right?
Right.
Why does my doctor want me to do all these things?
Yeah, like a colonoscopy, right? Or a mammogram, or even get a vaccine. Yeah.
Absolutely. So my mood? No, I'm kidding. So, there was a lot of work that went into these things. And
ongoing.
I can't give something to any patient just because I feel like it.
Yeah.
The process of any of these medical innovations, whether or not it's medication, whether or not it's screening, colonoscopy, a mammogram, a vaccine, the amount of scrutiny that these processes went through is quite impressive. If you look at kind of like the pipeline from someone came up with an idea, someone researched this on both animals, then actually did it with humans, and then went through the governmental process of justifying the need to approve these, then, which I think a lot of people don't know, is it needs to have the insurance approved.
Yes.
Actually paying for these services. That could take like a decade. That can take a really long time. And this takes, the eyes and minds of, probably by the time the process is done, several thousand people, right, in that process. It's probably several thousand people before we feel comfortable using these medical vaccines, medications, diagnostic modalities in the general population. So it's very, very controlled, where we just make sure that anything that we're doing, we're not causing undue harm. Right. There's actual value to that, right? Mm-hmm. We are actually helping the outcome of whatever individual that we're working with. And that being said, what might be good for you might not be good for me. Mm-hmm. And that's, again, we go back to why do I need a primary care, right? Because your primary care will actually help walk you through that process, right? Do you need a colonoscopy at 50, 45? Do you need it even younger?
Right.
I think this comes up a lot with screening for prostate cancer as well, right? What is your family history? What is the risk-benefit conversation around that matter? And then, some high, frequent conversations I have, right, is about cholesterol medication for what I always say, and I think I had this conversation 3 times today already. What is the investment in your retirement usually is how I have that. Because yes, we're lowering your cholesterol today, right?
Yes.
Doesn't really matter today. We're talking about trying to prevent you from having a heart attack or stroke, which typically happens.
Great way to think about prevention.
When you're done with work, right? And so, is that pertinent for you? And so I think, that's, again, it comes back to having that person that can actually have that conversation with you. Because if you go to someone that doesn't know you, they just look at the numbers and such. They might just say the guideline says X, Y, and Z.
Exactly. So putting those guidelines in context, like you were saying, individualizing, personalizing, but also making a really good, well-founded
100%.
recommendation.
100%.
I think prevention, and we can kind of move into my favorite segment, asking for a friend. But I think a lot of people are sort of like, do I need to do these? Do I need to do labs every year? Like, why do I need to prevent anything? And, the power of primary care is everything you've said, and also the power of prevention. And I do think that's why, thinking about this a lot over the years, especially getting younger people, right, who otherwise feel well, to establish with a primary care doctor is a little bit more challenging, right? Because they might not have a medication that they need renewed, right? Or maybe they don't have a screening that, Google says that you need. So what would you kind of message, do you guys think, to younger people about getting that primary care now? Don't wait.
Yeah, I think it's so nice to know that when you need a doctor at 2 a.m.
Yes.
Because you just woke up with, you're vomiting and diarrhea and you've got some kind of food poisoning and you need a doctor right then, that you've got one.
Yes,
and you know who you're going to call, whether it's then or in the morning. You know that you've got someone, in your pocket. And I think that's the value of having established care when you're feeling well, is that moment when you're sick and you're stressed out and something has happened, you've got someone to turn to, and you don't have to figure that part out in that moment.
Right, you can count on us to tell you when to worry.
Exactly.
And by the way, and where to go. I mean, I think it's hard, right? I mean, it's complex enough, right, healthcare. But then when we're asking our patients to decide themselves whether to go to urgent care, immediate care, the ER, just call us first.
Exactly.
We know you, and we'll tell you. We'll give you our best recommendation.
Right. I think we always say the word triage, right?
Yes.
It's like navigation.
Right.
That's what we should call it. Is where should that person be seen for that problem at this time? And we know because we work in that. And like we have all alluded to, it's really hard to navigate. It's really, really hard to navigate. And I think when you look at healthcare in America overall, we have a supply-demand issue across the board, whether or not it's urgent care, emergency room, outpatient, visits in the offices. So if we can save you 6 hours in the emergency room, we are very glad to do that, right? Because if that's something that I could actually prescribe an antibiotic and get you in the office tomorrow with me, absolutely happy to do that.
I'm so bummed there's a shortage, because it shouldn't be a privilege to have a primary care doctor.
Right.
So for all of you who are thinking about going into medicine, primary care is calling you.
We are. And,
you'll love it.
You will love it. And I think, it's a complete blast. And I do think, hopefully we'll see things change with the trainings, and we'll get more, residency slots and such. But right now it's just kind of the state of what's happening, and any change will take a little time.
I mean, but it's amazing for me to hear how much the two of you enjoy it. I mean, again, I know we completely work in service, right, of our patients, but I don't know, I think it's really meaningful, and it feels very mutual to have these relationships with our patients. I've had patients now all these years who I've taken care of since I was a resident, but I would also say they've taken care of me. They've seen me get pregnant, have children, watch them grow. I mean, it's really amazing. It really brings back sort of, we call it a clinic visit or an office visit. It's a visit.
It's a visit.
It is a visit. Like, we catch up with each other.
Sharing pictures of the kids.
Yes.
Entirely.
And it's a privilege for us too. I really can't thank you both enough for coming on. I would love it if you guys would come back. And again, all I can say is your patients are so very lucky to have you as physicians. We as UCLA Health are so lucky to have you, and I'm really lucky to have you as colleagues. Any last minute takeaways that you would want to kind of leave with our listeners?
Yeah, I mean, I think there's a few, right? It's like, feel listened, feel
Yes.
heard. Don't be afraid to ask questions. I think really feel, because we're talking about access issues on this entire episode.
Yep.
Right? And so you probably paid to park to come see someone. You probably waited too long to actually get that question answered. Get your question answered.
That's what we're here for.
That's why you're there. And, don't feel bad actually asking that, because the person in front of you wants you to understand that information.
Mm-hmm.
Truly.
Yeah, I think it's so true.
And I think come as you are.
Yes.
Yeah.
I think there
Yeah.
are so many barriers already to getting care, whether it's your work schedule or finding childcare or the parking or whatever it is. I want to try to allay one of those barriers, which is that mental part in the back of your mind that is worried that your doctor's going to judge you for something, whether you haven't been to the doctor in the last 4 years, or you've never been to a doctor, or you gained weight since the last visit and you guys have this plan to lose weight, or whatever it is. We are not thinking about that.
No.
And we are totally unfazed by it. And come as you are. We're here to meet you where you are and to walk through the next steps with you.
Yeah. I love that. Come as you are.
And before we wrap up, I think, Maria, you just hit the nail on the head there. I think there's a lot of anxiety about, oh gosh, things didn't go as planned.
Yes.
I never did those referrals you sent.
Exactly.
My mammogram.
Exactly. So let's normalize that for all your listeners.
By the way, I'm a patient. I don't get everything done.
Entirely. So the actual chance of any plan, is it a medication? Typically I think the data is around medicine. So the chance of us prescribing a medicine actually making it into a patient's mouth is about 50%. So don't feel bad, folks. Really don't feel bad.
Yeah.
We can start fresh. It goes with the weight. It goes with the referral. It goes with the mammogram. It goes with everything. And come as you are, both emotionally, but also physically. You don't have to clean your ears. You don't have to brush your teeth. You don't have to shave your legs. There's all sorts of funny things that patients feel like they need to do.
You do not have to perform for us.
You don't.
Or dress up.
You don't
get
need a
dressed
new
up for
outfit.
us.
No.
I just had that.
Just like this podcast. That advice is for all the guests. It's so true. We really are grateful for you as you come as you are.
Always.
Yeah.
Every day.
Always. I don't really think there's anything else to say. I can't thank you enough. I want to thank our listeners. And also, again, don't skip, come establish care. Don't skip your annual visit. And whether you're scheduling your first appointment, whether you're following up with someone that hopefully that you trust, we just really want to inspire you to stay with your healthcare journey and stay curious and be informed. And Maria and Will, thank you so much.
Thank
Thank
you.
you.